I started Trusted Ally 13 years ago now, and it's all because of my grandfather, Johnny. He was a nuclear worker that worked at 4 different sites, and he was the first to file a class action lawsuit against the Department of Energy. I saw firsthand what his work did to him, just physically. He got cancer, he got lung disease. And I also saw firsthand how having home health care really changed his life.
For me, it's always been about social enterprise, starting a business that can do well by doing good. So for me, Trusted Ally hit that note perfectly. It was an opportunity to be of service to people who've been of great service to all of us and make sure they get great care.
I was 19, Ronnie was 21 when we got married. He worked at Rocky Flats for 6 years. 1967, I worked there, and Ronnie worked from 67 through whatever 6 years is from there. Both of us were exposed. My husband had prostate and bladder cancer, and it metastasized to almost every part of his body.
I worked at Sandia National Labs for 10 years. I was a range master at that point in time. There was only a handful of us in the United States that had the certification for that. So I was contacted to come to Rocky Flats. It was a 4A facility which had a lot of nuclear components. We're talking about plutonium, uranium, americium, beryllium, and the list goes on. So that was our function, was to ensure that none of that stuff ever left the facility, period. After I retired, I started encountering quite a few different illnesses.
Trusted Ally has the privilege of working with former nuclear workers across the US, and we get to help them get approved for benefits and then receive amazing in-home health care.
Everything that we've needed, they have supplied for us with care, tender, loving care, not a clinical, sterile type service at all.
Currently, I have about 7 RNs, and they are wonderful. Each one brings something different to my care. They bring me a lot of joy. They bring me a lot of happiness. We laugh a lot. They keep me in good spirits. They keep me medicated.
Lynette is like part of the family. She really is. There was this one time when I did get sick after Ronnie passed. Lynette was here day and night. I wasn't in my right mind. I was so sick. And I told her, go home. And she was like, yeah, all right. So Trusted Ally has built that confidence in not only me, but also my children.
The most rewarding part of my job is when I get to meet with families and understand the impact that we have. That's the best part of my job every time.
The most rewarding aspect of what I do is when I go out either in the field or to different events and I have patients coming up to me and saying how Trusted Ally has changed their lives or saved their lives. That always gets me really teary-eyed.
It's a privilege for me to have the opportunity to speak about Trusted Ally. It really is. There's a lot of folks out there that may be encountering long-term effects as they retire. They need help at the level of which I'm getting.